Hi, I'm here to tell you about an upcoming workshop on emotion-focused therapy for complex trauma. My name is Antonio Pascual-Leone. I'm from the University of Windsor in Canada. I'm also an honorary research professor at the University of Lausanne in Switzerland and a certified trainer in emotion-focused therapy. My research is on psychotherapy, what works, how it works, and especially on emotional change. I focused a lot on trauma and on the principles of emotion change, studying emotion-focused therapy, dialectical behavior therapy, psychodynamic therapy, and other kinds of interventions, as well as training therapists on how to notice what to do while working in session. And my research on training therapists also informs the way I'll deliver this workshop to you. So, childhood abuse and complex trauma are extremely common. This is like people are often unable to heal past emotional injuries. And as you might know, there are very high dropout rates. There are a lot of neurological reasons for that. We know something about how the brain works, but I'll be talking about what the implications are in the session, right? One of them is that the difficulty these clients have with exposure-based therapies that aren't really designed for attachment-related problems. I take a very integrative approach as a therapist. I think therapists are often training in many approaches, or at least interested in many approaches. The reality is that the treatments work. And lots of treatments work, but you are the one who has to deliver it. So my approach is the better that the clinician understands what's happening inside the client and what you want to make happen, the better your interventions will be. The workshop will be based on this book, Emotion-Focused Therapy for Complex Trauma, written by Sandra Pavio and myself. It talks about childhood abuse and the treatment of childhood abuse, that would include physical, sexual, emotional abuse, as well as neglect. One question therapists often have is, do the different kinds of treatment, different kinds of trauma have to be treated differently? And the answer is no, not really. And we have evidence for that. We've also used this, and the puzzle of neglect is quite a slippery one. So we'll be talking about that. As well as, this has been applied to the treatment of domestic abuse victims and victims of human trafficking, which obviously represent more severe examples of relational trauma. But it's also been used for complex grief and what we would call unfinished business. So, the general approach is to explore feelings in order to transform maladaptive emotions. So I'll be talking about, well, what that is and how to know when it's happening and so on and so forth. This is an empirically validated treatment for both men and women suffering from complex relational trauma. I'll be presenting interventions that have been empirically supported for outcome, and there's quite a lot of process research, so we know how it works, which is helping with the teaching of therapists. So on the first day, May 3rd, I'm gonna present the theory on treating complex trauma, PTSD, and survivors of child abuse, and the role of emotion when working with trauma. There's a lot that happens. It happens very quickly, and getting oriented, locating the process is really key. Understanding how adaptive emotions can be identified and used is also pretty key. There are lots of feelings, but the question sort of becomes, well, which ones do I focus on? I'll also be talking about techniques for deepening client emotion, because clients will sometimes easily talk about their feelings, but how do you get them to feel those feelings? So that's a different kind of problem in terms of intervention, and we'll be giving you some tips for that. On the second day, May 4th, we'll use to introduce chair work for complex trauma. This is the enactments of imagining somebody that you're talking to, could be a perpetrator or somebody who's neglected you if you're the client. And giving clinicians a sort of a roadmap for thinking about where are we and where do we need to go from here. One of the things I really like about an emotion-oriented perspective is it helps with case conceptualization, not only in moment by moment in terms of what I need to do, but it also helps you think about the treatment planning. Where do I need to go? Where is this client, and what seems like a reasonable kind of target goal? Speaking of target goals, is this question of what's a good outcome, right? If somebody were depressed or anxious, they would have fewer symptoms, or they wouldn't meet criteria for depression. But when you talk about complex trauma, clients sometimes remind you that you can't really change the history of what happened. So what is a good ending? And we'll talk about that, which is kind of a very key thing in this treatment. Well, you already can see a bit about how I present, but if you want to get a bit more of a sense, there is this TEDx talk. The talk is something that's might be useful for your clients. You could send it to them. It's on YouTube. I was surprised how often it's been viewed, but it kind of gives you a sense of the client's end of how they might understand the treatment we're talking about here. But now I'm letting you know about a workshop that isn't designed for clients. It's for you. It's for clinicians. So I look forward to sharing with you new ideas as well as how to reapply old ideas in new ways. Let me teach you something that you can use when you get back to working with clients on Monday. That's the goal of this one-day workshop.